Greetings from Citizen Health and the Team Academy IAP Semi Connect, and in the series of People's Health It Matters. Today we have G. Krishna Babu. He is a professor in community medicine, Kakinada, Andhra Pradesh. We a warm welcome to you, sir, on behalf of all the audience.
Hello, everyone. Nice to see you and talk to you.
And thank you, sir. And I would like to say that today we are going on a very interesting and very important topic, that is family planning method. As we all are concerned nowadays that how much family should we have, and what are the methods to prevent an unwanted birth. And for this session today, we have Dr. G. Krishna Babu, and let's start the session without wasting any time. So I would like to ask my question first. What is the family planning?
Family planning is a way of life, but most of the times, what happens is people misconstrue it with limiting the children. It is not only the limiting of the children, but it is having full control over your sexual and reproductive health. Okay, so when we look at family planning, let us look at the audience who are supposed to be a part of this family planning. Now, the audience would be the part of the family planning is obviously a pair of individuals of opposite sexes coming together and starting life afresh. Okay, so when do people start life afresh? Is it necessary that it starts only after marriage, or does it also happen even before marriage, or does it happen with multiple partners? Sometimes it just happens that people would have multiple partners. So if you're looking at that, then the family planning, as I said, is a way of life, and it is has an element of responsibility involved in it. The responsibility is of both the people who participate, the male as well as the female. Now, if you're looking at the age at which the family planning starts, okay, now if you're looking at it, the human race, if you're looking at the human race, the males and the females attain puberty anywhere between 10 to 14 years. 10 to 14 years, they attain puberty. The moment they attain puberty, what it means is they have the capacity to reproduce themselves. Now, should we reproduce immediately after reaching puberty, or should we take some time for reproducing? There are so many factors which influence it. So, in the beginning, when you reach puberty, you are curious. You are curious. So, curiosity can cause insult, can cause injury. Insult in the sense, by chance, a girl becomes pregnant after a sexual encounter. Okay, that is insult. Injury, if you abort the child, it can cause injury, right? So, how to protect a person, how to uh, take responsible decisions in generating a family, in continuing with a family, is what family planning is all about. This tells you, this also tells you, you have a choice. How do you implement these choices? When do you want to get married? How early you want to have a child? How late you want to have a child? How many children you want to have? What should be the spacing between one child and the other? If it so happens that the couple is childless after marriage, then it also involves how to how the couple can get a child. So it is not merely contraception that we are talking about. We are talking about conception. We are talking about spacing. We are talking about how to avoid a pregnancy. Okay. So these things are incorporated into family planning. Yes.
Right, sir. And as you have said that family is a name which is a responsibility of men and women both. So what is the
Yes.
role of men in family planning?
Yes. Men have a significant role to play in planning a family, of course, with the help of the woman. Okay. Whenever we talk about sexual encounters, the sexual encounters are usually initiated by men. Okay, so the primary responsibility lies with the male. Okay, that is the first thing. The second thing is the male should realize that a sexual encounter can result in pregnancy, an unwanted pregnancy, a wanted pregnancy or an unwanted pregnancy. Now, in an unwanted pregnancy, how to avoid? Okay, and the male as well as the female are expected to know about the various methods that are available with us to avoid an unwanted pregnancy. Okay, and the male today, the male and the female seem to have equal roles of getting jobs, earning money, running home. Okay, so the responsibility towards family planning, though it is shared by both, because it is the male who initiates the encounters, it is the responsibility of the male to see that both of them are protected against conception, protected against sexually transmitted infections or HIV. Okay. Similarly, it is also the responsibility of the male to see that there is enough spacing between one child and the other child. Okay. Similarly, once the urge for having children is over, once the urge for having children is over, then the male also has the responsibility to see if a permanent method of contraception can be implemented. Now, if you're looking at vasectomy and tubectomy as two methods of permanent sterilization, vasectomy is much, much simpler getting it done compared to a tubectomy. But there are lots of cultural factors which influence the woman to think that getting a vasectomy done may impair the libido of the male, which is not so. Okay, so this kind of a reassurance should come from the male to the female. The male should be able to convince the female that nothing is going to happen if he undergoes vasectomy. Okay, as far as possible that. So this way, the spacing for ideally the spacing between one child and the other child should be at least 3 years. If the spacing is 3 years, then what happens is the woman gets back her vitality before pregnancy, which she had prior to it. 95% of her vitality is restored over a period of 3 years, and she's prepared to have one more child. And the outcomes will not be adverse if this kind of a preparation spacing is there between one child and the other child. Okay, this is another thing. The other kind of responsibility that is there is, when should a woman have a child? The ideal time for a woman to have a child is between the age of 20 and 30. Okay. Now, most of the marriages in India happen before 20, right? Most 50 to 60% of the marriages seem to happen even before the age of 18 years, especially in the rural areas. Now, an educated male, how can he help? He can delay the first pregnancy up to the age of 20, right? And for that, he needs to share information with his wife, convince convince the family members that the girl is not ready for a child at 18 years or less than 18 years, because her physical growth goes up to the age of 20. For the male, the physical growth can go up to 24. Okay, so, and at the same time, the male should also discuss about the number of children that they want. Normally, we don't discuss how many children we want. Children happen just accidentally. Okay, so that accidentally is a word which can be removed in planning. It can be removed in planning. You need to talk to the wife, talk about how many children that she would be comfortable with. Is she comfortable having a child? First thing is she comfortable having a child or not? If not, when she would be comfortable having a child? Suppose the woman says, I'm not ready for a child within the first year of marriage. Okay, it is the responsibility of the husband to see that the first year goes childless. Okay, sometimes they go childless for 2 or 3 years. They are continuing their studies, they are entering into their jobs, looking at continuing with their jobs, fulfilling their career dreams. Then it is the understanding of the male which matters more, okay, or the female. That's how the male has a very, very important role to play in family planning. Okay.
Right. And one thing I would like to add on, sir, that I would like to clarify that you have told us vasectomy and tubectomy. So I would like to know that vasectomy is for male part and
Yes.
tubectomy is for female
Female.
part. And the
Yes.
vasectomy is much more simpler, easier, and on a
Yes.
comfortable zone
More.
if
Yes.
we compare than
Compared to
tubectomy.
tubectomy.
So a
Yes.
man should go for vasectomy for a family planning
Yes. Yes.
method,
That
right,
is
sir?
their responsibility. It is their
Right, right.
responsibility of sharing the responsibilities in a family, right? So
And
that can be.
please, sir, tell us about what are the barrier methods and malady and all these things also comes in this, and what are the precautions should we take during
Right.
using these things?
Right. Now, if you're looking at age, we said that after 10 years, both male and female, they attain puberty, and puberty uh, gives them the opportunity to produce a child. Now, you're not ready for a child, but it can happen, an unexpected event. Now, the first 5 years, between 10 and 15 years, these are the young adolescents. Okay, 10 to 19 is the adolescent period, 10 to 14 is young adolescents. You are curious. Your curiosity should not end in a childbirth or an abortion, okay, or a social insult. So, this is where you need to protect. Barrier methods help in protecting the male and the female from having a child, and also they prevent transmission of sexually transmitted infections and HIV. Why HIV? If you look at the data that is there in HIV, 15 to 24 years, you have almost 50% of the HIV cases are in that age group. Okay, that also tells you that both males and females have multiple partners. That is the reason why you get HIV. Now you need to protect yourself. Okay, having a sexual encounter is not a sin. It is a normal part of life. Okay, having multiple partners is also nature's way of maintaining a gene pool that is there. Okay, so how to prevent an unwanted child and how to prevent sexually transmitted infections or HIV is by using barrier methods. And when we talk about barrier methods, we have barrier methods for males and we have barrier methods for females. The most common barrier method that we have for a male is called as a condom. Similarly, we have a condom for a female too, as a result of research that has been carried out in HIV. Other than the condom, what else do we have for a female is what are called as diaphragm. Okay, a diaphragm which is available. Now, the you should know how to use these barrier methods. If you're talking about a condom is used only once. For every sexual encounter, you need to use a fresh condom. Okay, so you need to know how to use a condom and how to dispose of a condom. This is a responsibility on which rests with the male as well as the female. Now, sexual encounters are not premeditated. Sometimes they can happen just like that. On the spur of the moment, they can happen. So you need to protect yourself, as I said. So it is not wrong to carry a condom in your pocket or in your purse. Okay, being that is you are being prepared for an un unmeditated event. Okay, it can just happen accidentally, right? So a casual sex, something called as a casual sex. So a condom is used by a male, and and the woman can always help the male in wearing a condom. So both the male and the female should know how to put on a condom and how to remove and dispose of a condom. Okay, so the condoms are available at every health center and sub center. Okay, you pay a rupee, you get three condoms. Okay, you wanted you if you want to have branded condoms, they are available in the medical shops as well as the malls. I can definitely have them. Right. The male condom is usually put on an erect male reproductive organ, meaning the penis. Okay. And when you're doing it, what you need to do is hold the tip of the condom so that no air remains in the condom, and then unroll the condom on an erect penis so it becomes snug and tight. Okay. Now, after the act is over, the semen is deposited in the condom. Now, the condom should be removed. The contents of the condom should be emptied and washed. The condom should be shred into small pieces and then it is disposed of. That is how it has to be done. The same is the case even with a female condom. Now, the diaphragm that is used by a female during a sexual encounter, it protects the sperm to enter into the genital tract, into the reproductive tract, meaning the uterus. So after the act encounter is over, the diaphragm is removed, cleaned. Okay, and the woman can wash herself, what we call as douching. Okay, douching is washing oneself. So this is about the barrier methods that are available. Okay, these are methods which can be used by the individuals, male or a female, before marriage, after marriage, or during extramarital encounters. Okay, this is about the barrier methods. The other method that we have for a female is for a woman who keeps a tab on her menstrual cycle. That is what is the menstrual cycle ranges between 25 to 30 days. Okay, so we take 30 days as a normal menstrual period. In this, there is what is called as a safe period. The first 10 days of the period and the last 10 days of the period are considered safe. The intervening 10 days that are there between 11th day to 20th day are considered as unsafe period, because during this period between the 12th and the 14th day the egg is released. Okay, the life of an egg is for 3 days. Suppose an egg is released on the 12th day, it can stay alive for 15th till 15th day. Suppose the egg is released on the 14th day, it can stay alive up to 17th day. Okay, so this period is something that the woman should know, provided she keeps a tab on her menstrual cycle. These days we have fertility apps. You can take the help of a fertility app and guide yourself to practice or have sexual encounters during this safe period. Now, if this is not possible, now now we are talking about two individuals, male and female, who are yet to be married. A sexual encounter happens, okay, and it is unsafe sexual encounter, meaning you have not used a condom nor have you considered the safe period. An encounter has happened. How to protect yourself? This is where what we have is called what we have emergency contraception. So, emergency contraceptive pills should be taken within 72 hours after an unplanned pregnancy. Now, coming to oral pills, who are the people who can use oral pills? Women who are not married, who have irregular periods, these are the people who can use oral pills. The advantage is that the periods become regular, the outflow is minimized, and the woman will not go into anemia. Okay, this is for an unmarried person. Now, for the married person who wants to use, the number of pills in a packet are about 30. Out of these, 21 pills are hormonal pills, and the remaining pills are placebo pills. Placebo in the sense they are iron and folic acid tablets that are available. Okay, so these have to be started on the fifth day of the after 5 days of menstrual cycle is over. On the sixth day, you start and take pill one every day at a specified period, usually at night. Okay, before you go to bed, have an oral contraceptive pill, because one of the side effects that is associated with the pill, which the woman does not like, is nausea and vomiting. She will have nausea, sensation of vomiting. So when you take a pill before you go to bed, the nausea goes into the sleep. So you will not know whether you're having nausea or not. Okay, and this has to be done every day till you complete the 21 pills and the remaining iron pills. Okay, so as long as you are using the pills on a regular basis, if you are disciplined to take pills every day, then oral contraceptive pills are something which you can try. You are not very disciplined, the alternatives that you have is once a week pill. You take one pill a week, three pills in a month. The fourth week you don't take a pill, so that you have your menstrual cycle. That is one alternative that you have, once a month pill. The other alternative you have is an injectable called Antara. Now the weekly pill I talked to you about is called as Chaya. Okay, and the injectable that we are talking about is Antara, which is available in the government segment. Okay, and an injection will protect you for a period of 3 months. Okay, so whenever you want to have a child, you stop taking this. Within a span of 3 to 6 months, you will become you can become pregnant. Okay, so these are the ones that are available to you. Now coming to one other important issue is, I told you that the spacing should be the ideal period for spacing is about 3 years. What is that contraceptive that is available to us, which will give us a spacing for 3 to 5 years or 10 years? Okay, so the intrauterine device is one such contraceptive device which enables a woman not to think about will I become pregnant or not. The fear of pregnancy is lost. So what happens is you can have an intrauterine device, a simple intrauterine device which we commonly call as copper T. Copper T, if you have, right, depending on the concentration that is there, 220, 380, like that, it gives you protection for 3 years or 5 years. Now you have a new contraceptives which have hormonal inserts into the property called as progesterone. These can prevent a pregnancy for a period of 10 years at a go. Okay, this is one way of doing it. The other one is we have what are called as implants, where we call it as Norplant. This is implanted into the arm. There are 6 sticks which are implanted into the arm, which are effectively used for a period of six, 5 to 6 years. 5 to 6 years. So these are the contraceptives that are available. Now, among these, there are certain periods where you should not be using. The mother has given birth to a child and breastfeeding the child. Okay, but during this period of breastfeeding, the mother can have sexual encounters which should not result in a pregnancy. So what are the available things that you have? You can go for an injectable which will help you, or a mini pill. A progesterone only pill will provide you. Every day you take that pill. Lactation is not a problem at all. Okay, you can feed the child and at the same time enjoy your sexual encounters. That's how contraception is planned. Okay, now for the woman, the reproductive period is between ages of 15 to 45. 15 to 45. So what all we have talked about so far, the contraceptives can be used by the woman. Now the woman has achieved her requirement for children. She wants to one child, she wants to stop, no more children. Two children, no more children. Three children, no more children. This is the time when you really need to think about a long-term spacing method or a permanent method, either tubectomy or vasectomy. Okay, vasectomy is much simpler and it is as effective as a tubectomy. Does not cause any side effects to the male. He can do his job normally, can participate in family life normally without any hindrance. There will not be any lacunae in it. Okay, so this is what we talk about family planning between the ages of 10 to 24. okay, where you protect yourself against pregnancy and sexually transmitted infections and HIV. Then between 20 to 30, where you have a need to have a child, where you have a need to space between the children, right? After 30, okay? So after 30, long-term in spacing method or a permanent spacing method. Now coming to the couples who want a child, who are childless, who want to have a child. Now these are the couples with whom you need to carry out counseling. Counseling for natural methods, counseling for in vitro fertilization, IVF methods. Maybe you need to send them to a center, a higher center, which will enable these couples to have a child. Okay, so a lot of counseling needs to take place. So you can't take family planning as a simple method of just mere contraception. No, here the couple has a responsibility, jimmedari. Okay, if you have the both of them have a jimmedari to plan a parivar or a family. Once the children are born, how to bring up the children is also part of family planning till they become ad- adults, responsible adults. Okay.
Right, right. Thank you so
Okay.
much, sir. Thank you so much for talking to us. It was very nice session to with you, sir. Thank you.
Okay.